What's up, guys? Happy Friday.
Now we're recording.
Yeah. Dr. Aaron Hartman, welcome.
Super excited to be here.
We didn't tell you. We only ask one question, which is very vague, and it's how'd you get here?
Yeah. And I didn't I didn't get to that because I was reading up on you before here, and like honestly, I think you have like more stuff to talk about than we could talk about in like 7 shows. So like I was like, all right, let's just
let you steer the ship.
Okay.
All right, listen.
Be careful. Gotta be careful.
Yeah, oh, listen,
that's all right, man. It's called the Reverend Health for a reason.
Good point. So
I have 2 things that
want to go off the cliff is what you're telling me.
Yeah, exactly. That's
look,
exactly
man. You want to get weird? We'll go right with you.
Yeah.
Oh, this is not weird. This is all cool science based stuff.
Yeah, we're into it.
There's one thing that if I don't get out of my head, my kids might kill me, and I'm definitely going to scratch that itch. Saturday Night Live killed your first name for everyone for the rest of time. Aaron.
Wait, no. Aaron, that was Key and Peele.
Like Key and Peele. Okay, yeah. I was like, yeah.
Unfortunately, I know exactly what you're talking about because my brother sent me that thing. It was hilarious. It was hilarious, though.
No, it was funny, but my kids literally lose their minds when they hear that skit. Like it's like years later.
I think I have a sticker of that. I'm like looking around my office. I'm like, I have a pile of stickers somewhere.
Yeah. If they're to do that now, though, that you can't do that kind of comedy anymore. It's kind of sad, actually.
Yeah. That was
hilarious.
one of the funniest things I've ever seen. My kids literally just cannot stop laughing though. So if they knew I had an Aaron on and didn't at least say Aaron, yeah, they might kill me. The other thing that I think is awesome, and we talk about this a lot on here, you win the prize hands down.
Longest number of letters after
solitary. Yeah, like you are an apex predator of. Yeah,
dude, I like that, man. I'm an apex. I love that. I'm gonna use that. I am.
You
the apex
are
predator of the
top of the heat, brother. Like it does. I have not seen this.
I
was trying, man. I really was.
Yeah, I actually stopped putting the letters on there because after a while it just got a little much, and I haven't updated that in like 4 or 5 years. So there's already like a couple more on there, but after a while it gets kind of like, what's the point, you know?
Your business card printer is like, fuck this guy. Jesus
this guy can't even fit a phone number.
The graphic designer's like, what do you want me to do with this?
Okay, that's MD. We'll stick with the MD.
No, I love it.
Well, no. I mean, you got all the right things, you know?
I had to look a lot of these up, and like I've got to admit I didn't know most of these, and I love like how deep you've gone down these little thought holes that you got into, because I mean there's a lot of knowledge here and a lot of I didn't even know you could get trained up in some of these, like a lot of the functional and longevity ones in particular.
I mean, there's a board certification. I mean, there's a board certification in it. I mean,
I love it.
Medicine. I mean, it's legit. You know, my SIRS training, which I don't think I did on there, was through George Washington University. It's like a certification. Actually, I don't think that's on the list of things. That was like a 1-year process. That was not easy. Yeah. You know, so
right.
It's not a weekend course.
No,
so,
it's
not a continuing education situation.
I watched the YouTube video.
Yeah.
No, yeah. And now that's the way a lot of things are these days. You watch a video, do a e-course, and now you're a functional practitioner. And it's
I know.
Yeah,
like,
believe me.
Like that's not quite what I do, but welcome to the camp, I guess. I don't know.
Let's talk about that for a second. What is the difference between, like, I mean, how are we getting away with that, I guess, is the right question.
Well, functional medicine is not recognized by insurance companies and the government. So, yes, the Cleveland Clinic has the largest functional medicine clinic in the world. That's a pretty legit, probably one of the top hospital care systems in our country, if not the world. Yes, you can get a master's in functional medicine training at University of Maryland. You can get your postdoctoral training at University of Arizona. Yes, there's blah, blah, blah. But the point is, like, there's not like the ACGME, which is the National Organization for Board Certifications, has not recognized it.
Is there a reason? Do we know why? Is it just too
there's no money in fixing the root cause of things.
Yeah. That's a good point, Tom. But what I'm going to say, I'm going to be more generous and just say when emergency medicine wasn't a residency, it was actually ER docs in the 60s and 70s were just internists or family practitioners that liked working in the ER. I mean, it wasn't until like the 80s until you get a board certification in emergency medicine. Family medicine, which is why I got my board. Initially, it was a 1-year thing. It was just your internship, and you did general medicine. You're a general practitioner. It didn't become a board certification until the 70s. Being a hospitalist. I did all my own hospital care. It wasn't you just did it. Now you can get certified in. So it takes 15-ish years plus or minus when something starts to pick up before it turns into like a specialty. And we're kind of like in that 7-year mark to the 15-year mark. So it'll probably be insurance companies are talking about sometime in the near future starting to reimburse for what I do. But currently it's not a thing. And so it's just a typical thing. It takes the government forever to catch up. It took them 50 years and 7,000 research articles before they said, hey, guess what? Smoking causes cancer, So people forget, in the 50s, doctors told people to smoke because it was good for them, right? So,
4 out of 5 doctors prefer Pall Mall.
Yes. This is real. People don't, this was legit. This was real. This was a thing. And so it just takes a while. Yes, there's money. Yes, there's special interests, and that just slows it down even more. But
right. Who's fighting against? Put on our conspiracy hats for a quick second. Who's fighting against fast tracking this as a specialty? Like, is pharma not like this? Is somebody against this idea?
I don't think there's one. There's not one evil.
There's not a cabal.
Yeah,
it's just kind of the process.
There's not a Sith Lord back there.
Yeah, right. Okay, got it.
But it's in general, like a lot of I'm a medical doctor. I do use medications, but I use them off label. I compound them. So a lot of times, I used to use almost exclusively prescription branded stuff, and now mostly it's compounded and nutritional stuff.
Right.
And so I'm not a big money maker for the drug reps to come visit me anymore, or the companies. Insurance wise, I'm seeing less patients now. I used to see my busiest year, I had almost 6,000 patient encounters.
Wow.
I was taking care of almost 3,000 people. Now I'm taking care of about 300 people, and I'm having, I haven't done the numbers in a while, but a lot less. And so the insurance companies, I've become less of a thing for them. The where I'm practicing medicine is outside the standard of care. So now the board organizations are like, why is he using low dose naltrexone to treat autoimmune issues?
Yeah.
What organization says that's okay? I'm like, well, there's like decades of data on it, and it's pretty safe and it works. So why not? And so there's different angles that are kind of slowing the whole process down. Medical schools, are like, this is hooey, it's not legit, But then some schools literally have like tracks we can do a month in a functional medicine doctor's office. So even let's do the East Coast, West Coast thing. In California, you can get, naturopathic doctors can get a license to practice medicine. In Virginia, you can't. It's not naturopathic doctors literally can't touch a patient, and they can't make a recommendation.
Wow.
Doc, where are you out of? Where are you practicing out of?
I'm in Virginia.
Yeah.
Okay.
So the only reason you can get away with this is because you're an actual MD, and
I can do the medical doctor is at the top of the food chain,
sure,
in the medical world, and so
the apex predator again.
Yeah, the apex predator. I am the doctor.
That's a lot of school. It's a lot of school.
It is a lot of school.
But so because of that, we get after my internal medicine surgery internship, literally I got things that I was certified in medicine and surgery. Back in the day, I could have started to do C-sections and surgeries, 50, 60 years ago. Is any hospital going to let me do that today? No. But like back in the day, that's what that kind of meant. So, so just when you're at the top, you get a lot more leeway, but you also have a lot more to lose.
Yeah.
Like if I mess up, I get sued, I lose my practice. Multi-million-dollar suits. So there's a lot more to lose as well, which is one of the reasons why medical doctors are less likely to change the way they practice medicine.
Right.
If you have a $300,000 school loan and your local insurance carrier, which has happened to me before, says, if you don't stop this, we'll remove you from our insurance
panel.
Yeah. Blue Cross, which is like the second biggest, it's Medicare here in Richmond, then Blue Cross. And all of a sudden, do I keep on using that lab that they don't want me to use, or do I just have my patients pay cash is what I end up doing. But the point is that,
are you in more of a concierge type practice then? If you've reduced your patient load and you've switched to a cash base,
it's a membership model.
Okay.
Yeah, okay.
So membership is basically, I still use insurance to fill what insurance pays for. The biggest expense when people see me is actually labs. I mean, it's like $8,000 worth of labs.
Yeah.
It's a bunch of money. You want your insurance to pay for that, right?
Yeah.
So, but then it takes me an hour to 2 hours to interpret the labs. It's a 2-hour intake. I'm reading your chart now. It's almost 6 hours for that intake time frame. So, and the $100 your insurance pays me for that time doesn't cover the expenses.
Not worth it. Yeah.
Yeah. So the membership.
I'm in like a membership one too, called
and we have
MDVIP.
friends that are functional practitioners here in Baltimore and around Baltimore. And there, would you describe it as like a direct primary care, or is it no membership is a completely different model?
Yeah, direct primary care is where you're basically, this is all you pay, period. You pay your $75 a month.
Yeah.
And no other expenses. I'll see you however many times. And instead of taking care of 3,000 patients, it's usually 900 or 1,000. Every visit's 30 minutes. In the membership model I have set, people are paying for all those letters you joked about. That's what you're paying for access to that. Because our current insurance model doesn't pay for cognitive work. It pays for procedural work.
Face-to-face patient time.
Yeah, correct. I mean, back in the day when I did a lot of skin cancer stuff, someone come in 15 minutes, I'd remove a skin cancer spot. And I got paid like $300 for that, for 15 minutes of work, which is pretty good pay.
Pretty damn good. Yeah.
Then I'd walk over during lunch to the hospital, manage my patient in the ICU with the intensive care, the cardiologist, the surgeon there, be an hour with them, get a bunch of phone calls. I get $83 for that because I was because of cognitive care. And so the cognition, the brain work. And so our insurance model doesn't pay for thinking about people, doesn't pay for thinking for patients. It pays for doing things to them, which is one of the reasons why we proceduralized so much in our country.
Yeah, and I got out of that a few years ago. I've been in a thing called MDVIP, which is, I think, national. And similar idea. Yeah. Wow. I want to hear more about that.
Matt will drive to Virginia. It's not that far.
To Virginia. Yeah. I mean, listen.
Well, there's concierge, you're paying for time to the doctors, which is great because just having more time to ask more questions, Matt, to be more inquisitive will make me better at my job. And I learn more. You learn from patients. But as far as care, like if your cholesterol's high, does your doctor, after saying diet and exercise, do they then say take your medication? Or do they say why don't you use balanced omega-3s and omega-6s? Why don't you use berberine? Why don't you use aged garlic? Hey, your LP(a) is up. You probably should use liposomal vitamin C and NAC to lower those things. Are there other options before jumping to a medication? That's where what I do is different because there's other options to the same data point that unless you have the training, you won't go down that pathway. And if it's stubborn, we can't get your cholesterol down. Maybe it's from a toxin exposure, heavy metals, chronic infections. That's a whole nother rabbit trail of stuff for this with heart disease.
And I will say the answer to your question is yes, with an asterisk, because I had to go through 4 or 5 MDVIP doctors in my area to find the one that I thought could, excuse me, the one I found. His wife is a cardiologist. His dad is her dad is a cardiologist. So like in anything lipid related, he's like weirdly overly indexed on that just because he's got cardiologists left, right, and center. And so in that regard, I don't know that that's normal though.
I would not.
Yeah. Right. I know I had one who was like just not great. And he was basically like, yeah, I'm just getting paid better to do the same stuff I was doing before.
Yeah. Here in Richmond, we have one of those high level places where they do the whole body MRI.
Yeah.
They do the fancy gallery cancer stuff. And they do a partial Cleveland Heart Lab panel on people. And I've had one of my patients go there because they want to make sure they're not missing anything.
Sure.
Make sure it's your money. You can spend it.
Yeah.
I'm a consultant. And he came back with a prescription for Crestor, cholesterol medication. And I'm like, wow, you just dropped $15,000 on all that stuff to get a prescription, not to get why is your cholesterol high? Why is your HSCRP, your inflammation off? And it's an interesting factoid, according to the EPA, 30% of heart disease in our country is directly related to lead exposure.
That's interesting.
So
where's that coming from?
I have not heard that statistic.
Where's your lead level? And when it's high, cardiologists should be lead experts, right?
Where's that coming from? Where are they getting lead?
Well, okay. Well, part of the caveat, how old are you? Because if you're born
49.
after 90,
Yeah.
Well, if you're born after 91, the lead exposure is much, much less. If you're born before 91, well, the 70s, we kind of started removing lead from the gas. It's still in airplane gas and different other vehicle gases, and then lead paint. So basically, all those things kind of work their way out before 91. So if you're born before 91, odds are you have some lead in your system. And lead, 90% of lead is stored in your bones. It takes about 6, 7, 8 years for your bones to turn over. So basically, and it takes about 4 to 5 half-lives if you're not exposed to anything anymore, period, which is not the case, to clear something. So if you had lead exposure, it might take 25 to 30 years to clear it if you had no further exposure.
Wow.
So all of a sudden, your child exposure from just gas and the paint in your house could be the reason why you have a lead level of 3 or 4, which is not so bad, right? But it's still lead, right?
It's still lead. Yeah.
It's not exactly pleasant.
Yeah.
So that's interesting.
Just a little lead. Just a
little lead's okay for you. Yeah. No, and that's
and then but compounding that with like detoxification pathway issues, and that is a lifetime of problems.
Well, okay, so let's take it a little deeper, Tom. Right?
Yeah.
There's a thing called an LD50. LD50 is the amount, and this is a toxicology term, how much of a chemical you get exposed to that half the population dies. Okay, so you get exposed to now. So let's take the LD1, which is like if 100 people get exposed to this dose of lead, one person
dies.
Right.
And take the LD1 for mercury, 50. You expose 100 people, one die. You put them together. What is the new LD? It's 100.
What?
100% of people die. So these things are not just additive; they're multiplicative. And to your point, Tom, it might be a touch of lead and a little mercury and a touch of arsenic from your groundwater because the Eastern Shore, and you're in Baltimore, so you had that thing crash on the bridge like a year and a half ago and dump who knows what into the Chesapeake, if you remember that, right?
Yeah.
And you add that up with the other thousands of chemicals in our environment, and all of a sudden it's like, this is a big toxic stew that's affecting
yeah.
I'm sorry, Doc. I'm laughing because, for years, right, there's been this initiative in the harbor. They put a whole bunch of oysters in there to clean it up, make it swimmable. But when I first moved down to Maryland 20 years ago, I've had a clinic a couple blocks away from the harbor, and I'd watch somebody walk down with a crabbing net. And I immediately would go, yeah, that guy looks like he eats crabs out of the harbor. They look toxic.
Yeah.
And I'm not knocking anybody. Don't show up at my clinic.
Every place in the country has a story like this, whether it's Indiana, whether it's Michigan. Again,
I hear Flint, Michigan's.
What? Yeah. How long has it been since they've had clean water?
Have they ever had clean water?
Yeah, that's true
that's a
too.
great question.
So, but the Chesapeake Bay, right? You go to the bay, you catch fish, oysters, whatever. In Virginia, there's all these rivers that go into it, and all these signs: do not eat. Do not sell anything captured here. But once it mixes in the Chesapeake, it's okay to catch and sell. I had a patient went to Deltaville, which is it's in the bay. It's south. If you come right down from Maryland, it's kind of south. And across the bay, which is a couple miles, there's actually a chicken factory, dumps chicken feces stuff into it, because that's what happens, right? He was fishing, got a hook on it, got a little infection. 3 days later, he had his finger cut off at the hospital at St. Francis across the street because of flesh-eating bacteria from a hook thing from fishing in the bay. And then infection was associated with chicken feces and chicken factory stuff, which was like, okay, that was across the bay, right? From where he was. So the environment's a big deal. And you got to pay. And part of my training and part of my stuff was actually environmental medicine to figure out how the environment affects people's health.
Wow.
Yeah, and that's
which is so overlooked.
I not just overlooked. I don't think anybody even really understands it. I mean, over the break, I got it down a food documentary rabbit hole, and and like some of this stuff I knew, a lot of that stuff I already knew, but there was a couple things I just didn't know. Like one of the things was the pig farming would take the feces and put it in basically sprinklers and spray it over a field, which is just aerosolizing all of that. And I'm just like, how did anybody think this was a great idea? Like, just common sense wise, this doesn't feel like a good idea, let alone what the hell it's actually doing. And then, of course, you talk to the neighbors, and half of them have inexplicable cancers and all kinds of health issues. And it's like, oh, that all kind of makes sense.
So, arsenic in chicken feed was voluntarily removed. I believe it was about 2012 from public pressure. Before that, all the chicken feed, and my dad actually, when he was a kid growing up in West Virginia, oh yeah, we the arsenic in the feed, it causes gastritis. The chickens get a little stomach upset, so they eat to treat it, so they get fatter quicker. But you're okay, it's safe if you take it out of the feed 7 days before processing. And we were literally getting arsenic in the amounts in the chicken. Don't worry, it's not too much. It's a little bit, right? And it wasn't until 2012 that they were voluntarily removed. Now, voluntarily removed means that they can voluntarily put it back in or sneak it in or whatever.
Yeah.
But 2012 is not.
That's not that long ago.
Not that long ago.
No,
yeah.
No, not at all. No.
So wait a minute. Let me get this straight. They're feeding arsenic to chickens to make them want to eat more?
They get fatter quicker, yeah.
Jesus.
I've got a farm. Part of my story is being a gentleman farmer and raising my own cows and chickens, and I've got my chickens back there, and we raise them, blah, blah, blah. By the time it's about 6 months until they start laying eggs, and before you get big enough to you want to process them, maybe 7 months, whatever. The typical time for a chicken to get plumped up, fat, it's 9 weeks. Sorry, 9 weeks. Yes. And so it used to be 12 weeks, it used to be 14 weeks. They've actually, between interbreeding and feeding and putting antibiotics, you want to get something fatter quicker, you put antibiotics in the feed. Like 80%.
Is that an inflammatory kind of response, or is there, what's the reason for that?
Antibiotics have an impact on your gut microbiome.
Okay. Makes sense.
That result in obesity, which we've known since the 50s in agribusiness and cows and chickens and sheep.
I did not know that part. Yeah.
Yeah. And then we wonder why are our kids getting fat besides the food and all that kind of stuff? Is all the antibiotics, is that potentially affecting them? No, it doesn't do that in humans. It only does it in cows and chickens and not humans, right?
Every other mammal on the planet.
Yeah, but we're different.
We're all supermen.
We're immune from that. Don't look here.
Jeez.
The point is, there's so many examples of this over and over and over again. We used to use mercury and arsenic based antifungals in apple farms, for example. And you'd have, back in the turn of the century, they've used mercury, arsenic, and get in the soil. And all of a sudden now it's like they get tore down. You have a neighborhood pop up. You have elevated levels of the stuff in the soil, and now mom's getting a garden back there, and the kids are playing in the dirt. And you're like, I had one patient. This is an interesting story. Been working with her for years. Had a bunch of issues, got her better, and all of a sudden she started getting sick again. Checked her, and arsenic level was sky high.
Yeah.
And come to find out, her next door neighbor put out an arsenical chemical to keep snakes away. And enough got in her yard, in her garden, outside, that she actually got exposure to have elevated arsenic levels.
I was actually going to ask you about that, because if the chicken feed, even though it's voluntarily out, those chickens are crapping everywhere. Yeah. Does that get into this groundwater, and now is the soil in those areas, are the plants and things that are planted in those areas impacted as well?
So you said you're all in Baltimore. One of my wife's favorite places in the world is Cape Charles. It's the Virginia Eastern Shore. We were looking at that place. We go there. We love it. So one day I decided to check the water quality. Arsenic level sky high, and the water. And this is the environmental working group has a database you can go to.
When you say water level, you mean out of the tap, or you there's a pond?
We don't line to check it through the environmental working group.
Okay,
you can take your zip code. They basically check water from city municipalities.
Okay, got it.
And you can take your zip code anywhere in the country. It's ewg.org, and they have a water tap database. You have to kind of.
Matt's typing it up right now.
Doing it, yeah.
Oh my gosh. Everybody has, whether it's chloroform, dibromomethane, hexavalent chromium, everybody's got at least 6 or 7 things in their tap water. And the question is, you drink the tap water, or are you filtering it? And I checked it for Cape Charles, and the arsenic was sky high. By the way, it's a big agriculture area. They spray stuff there. One of my patients was actually telling me, because she's from the areas, they actually, back in the day, used a lot of arsenic-based antifungals, et cetera, in the agriculture there. So it could just be residual. It could be old stuff, or it could be new stuff. Who knows, right? But
I'm guessing that stuff doesn't dissipate over time.
Well, it's not just the one thing. Like, just go there, ewg.org, the water tap database, put your zip code in there, and how many things pop up?
I'm very afraid to do it.
Yeah, it's too much to do while I'm on the site doesn't make it easy, so I'll find tap water. I'm like, this doesn't actually do well. But
I need one win, Doc. I can't. I'm too fragile at the moment with world affairs.
I'm sorry. Well, that's that's the reason why having a whole house water filter is important, because a lot of these, like chloroform, chlorine gas, dibromomethane, these are actually secondary chemicals that break down products of the cleaning stuff they use to clean pipes and tubes and stuff, and the city municipalities, water treatment plants, and all that kind of stuff. And so it just comes through, and a big exposure is actually inhalation in your shower. If you look at that thing, you'll see chloroform is one of the many breakdown products of chlorine, right?
Chloroform is 65x in Baltimore in our zip code, by the way. I did.
Oh no.
Yeah. I don't know what that means, Doc. So it's
65 times higher than they think it should be based on the research.
Oh, Jesus. Bromodichloromethane is 120x, Tom, just whatever the fuck that is.
But the point is, like, an activated charcoal filter will get out most of that. And so
this is not a heavy lift to kind of correct it, at least in the home. No.
Yeah, correct. Yeah. And for me, what I recommend people doing, without getting too crazy, if you put a whole house water filter, everything gets filtered once. So that minimizes skin exposure, shower exposure. And if you're in a city municipality, it won't get out everything. It'll get out like 60 or 70% of hexavalent chromium, for example. So then getting a second activated charcoal or British Berkey or some other filter that for your drinking and cooking water, who cares about the flushing toilets, right? Then all of a sudden you can get out. And then test it, test it individually. I use watercheck.com. It's not NTL Labs. It's a national water testing lab place. And you can take the water and send it off to them. That's what I recommend people do, and kind of whittle it down until your water is clean enough to drink.
Sure.
Yeah.
And I have one of those 0.5 micron whole house filters on there. And actually, it's funny. Even my kids, like when I'm lazy and just haven't gotten a new one, and I just take it off for a couple of days because the water pressure's to like 0. They're like, why does the water taste like shit? I'm like, I'll go to Home Depot later today.
That's mine.
Yeah.
I'll fix it.
Well, it's, we talk about this functional medicine, this fancy stuff, and oh my gosh, stem cells, exosomes, and that's so expensive and I can't afford it. The foundational stuff is what people have to perfect, and what I perfected with my daughter. Clean food, clean environment, clean water. Just if you focus on those things, all of a sudden, like, it's amazing how much better people feel and do when the water they drink is clean. They drink plenty of it, not practically dehydrated. The food you eat is real food, not processed, real healthy fat. Your air is clean. Half of all buildings in the United States have water damage. Mold-related illness as a biotoxin was actually discovered in Pocomoke, Maryland, not too far from you all. Was actually where, back in the late 80s, I believe, Dr. Richie Shoemaker discovered it. And there was actually fishermen, watermen, were actually going crabbing and stuff and getting diarrhea and aches and pains. And it was actually from algae overgrowth, this biotoxin, right? So all of a sudden, the air you breathe makes a difference.
Sure.
And so if you just clean up things and live a good life, focus on the basics, you can have a profound impact on your health. And that's what we did with our family. And that's what I do with patients.
Yeah, we had a guy talking about dust on our show a while
back. He was
back.
A home air specialist.
Yeah.
And he had some crazy, I mean, he has people take dust on the top of door frames, like places you wouldn't normally clean, and put it into a test tube. And when you get like a couple milliliters of this dust, they actually can do a dust DNA test on your house. And he said it's fucking bananas what they find in people's houses, and so he was talking, he's like, look, do nothing else, just clean your ducts once a year. Like put a higher Marvin, I can't remember the name. The MERV rating on there. So of course I went out and did that. And I will tell you, here's the downside of all this, Doc. And I think this is where most of America gets fucked up. Those filters, my filter went from like a 1/2-inch filter to a 3-inch filter. Like I got like a MERV 12, so it's like this massive filter. it does not last more than 4 months before I can start to hear my HVAC system literally start to like strain. And if I'm being totally honest, like that means the 4 months that I should be changing it really is like 6 months, and then who knows what's happening then, you know?
Yeah. Well, is that filter on your air handler?
It's on my main air handler, and I actually have two air handlers, and the top one couldn't afford a bigger filter media, so I can only do a MERV like 10 or something up there, because that one I can only fit a 2-inch filter media in there, so it was more of a physical limitation.
Dust.
It does. I've got kids and dogs and rabbit.
Carpet?
Very little, but we still do have some carpet. Most of it's hardwood floors.
Yeah, the thing about the air handling system, and this is one of the things that a lot of people don't realize, the purpose of doing that stuff is only so your air handler, your air conditioner unit does not become a source for stuff in your house.
Right.
You're not actually removing the dust in the rooms, right? And that's where having a HEPA filter in the bedroom where you sleep, for example, having it running 24/7. Well, because what's more important, you know, that there's no dust on your air handler, which is important, or there's no dust, a lot of stuff. You're not breathing that when you sleep at night.
Yeah, I have one of those. I put one of those in most of the rooms.
Are you saying so? Then the more impactful and probably cheaper fix is air filters in the room.
In order to filter air for breathing, you have to have laminar flow.
Okay.
So laminar flow is like a river, right? It's like a clean room, like a surgical suite. You have to be moving air. Your air conditioner conditions the air. It's not moving enough air you don't feel it. When the air conditioner cuts on, you don't feel a breeze, right? And hopefully you don't hear it. Hopefully it's quiet.
You got one of them fancy ones, Doc.
Yeah.
I think I got 3 hamsters on a wheel running in there, and it needs oil.
Yeah.
Okay. Well, you know, I try to major on the major and minor on the minor. So
I gotcha.
Clean air is a big deal.
Clean air is a big deal.
Yeah.
No, but, those little ones, you can get these things on Amazon now for really cheap, actually. Like
Costco.
Yeah.
Well, even I read reviews of the IKEA ones. They're like $100 for a pretty sizable unit, and they work really well.
I have a 400 square foot one on Amazon. The filter media is like 6x6. It's got on both sides. It's charcoal. And it runs 24/7. And I have it in my office. It's only about 150 square feet. So I'm over indexing on it. I keep it at like 8 out of 10, so I don't hear it. Because if you're at 10, you just hear that
the whoosh. Yeah.
But I mean, listen, I walk into this room with 2 ferns in here. Since I put the 2 ferns and that thing in here, I walk in here in the morning and it feels different than it used to. There's like a lightness to the air.
Matt's copying Zach Galifianakis there.
Listen, man,
that's a really niche joke, but
I cannot tell you how stupid of a trick this was that made a huge difference in my office. I'm in this office 10 hours a day, you know?
The most important thing, you can buy these fancy air filters. You can spend $2,000 on them. It's kind of crazy. But the most important thing is that the filter media is a true HEPA filter.
Right.
And you can get those, like to your point, anywhere. And then all of a sudden now the box around it, you know, is it a fancy box you can use your phone with? Yeah, that might be lots of money. Or is it something less impressive and has to move enough air? So it has to be sized for your room. And you can, for $180, you can get a really nice one, or potentially cheaper. The one I have is a WinX, and then like I use Austin Air in my bedrooms. But the point is, like, it's not super difficult to do, and it have a way bigger impact on air quality than a lot of things that are ridiculously expensive.
So now I want to tell you something my wife sent me on social media, which I'm just about redneck enough to try. 3 AC HEPA air filters with 4 put in a like kind of a box position, and then laying a box fan over the top of it. So you're pulling the air up.
Wow.
So what you would do is make a square out of those air filters that you put in the air conditioner.
Okay.
And then you just have air pulled through have air pulled through those filters.
Oh, wow. Okay. I mean, that's super cheap.
Super cheap. I don't know how effective it is, because you do you'll probably burn that fan out if you put a high MERV on there.
Yeah, well, that's one of the things with the you have to be careful with these things, is because if you put a high MERV and it's not sized right, you will, to your point,
blown out your unit. Yeah.
The reason why you want that big one, I think, Matt, you had on your that goes right, the pre-filter. Those you can get like MERV 16 for those things.
Yeah, I forget I want to say it's definitely over 12. I thought I tried to get a 16 and I couldn't or something, but it's in that mid-teen range for sure.
And the 16 is basically like a HEPA filter. And the purpose of that is just to make sure you don't get particles on your coils.
That's exactly, right.
So that you don't grow stuff. And I'm a little anal, so I have a UV light in there as well. And so if something gets there, it doesn't grow. And then all of a sudden now you're moving clean air. It's super basic. I just don't know why it's not standard of care for buildings and not standard. There's so many people who get sick because of their environment, because of mold. Half of all buildings in our country have some kind of water damage. About 23% of the population have this gene that increases their risk for mold-related illness. So all of a sudden, how many people with chronic fatigue, fibro, some of the first long COVID patients I saw back in 2020, they were having long COVID related to their workplace was moldy, their home was moldy, and it set them up, and their COVID just lit the fire. A clean environment's a big deal.
Yeah. And this all reminds me of the one thing that we keep seeing on this show a lot is like, it's great. It's easy to be healthy if you're loaded. You know what I mean? Like,
but I also feel like it's a dual kind of problem, because not only is it a financial barrier, but just, like we kind of play in this space, right, Matt? I didn't know half the facts Dr. Hartman's talking about here, right? Like, I didn't know the water was that bad. I didn't know, and it's not something I think that school would be covering, and it's not something the government or the municipality that's pumping out the water is going to be like, we have 365 times the amount of this carcinogen in it.
We have,
believe me, I looked it up. We're like,
what the hell?
Like well over 300% in certain areas.
Yeah,
and
824 times higher in halicetic acids, HAA9. I don't know what the hell that is, but that doesn't feel right.
Well, now I'm like, geez, I got to figure this out. How do I retrofit one into this tiny little townhouse?
Well, that's where anyway. Yeah, you can they do make activated charcoal thing. You can put just on the shower head.
Shower's head, and that's probably what I'm going to end up doing.
Yeah.
Honestly, I've had 3 houses now that I put a whole home water filter in. It's like a few hours on a Saturday afternoon and half a 6-pack of beer to do. You know what I mean? Like, it's not a hard thing to do. It's $50 in parts from Home Depot. It's not that big a deal.
It's not a heavy lift. Yeah.
Well, I think, Tom, to your point, like the whole thing with the cost point, like, people like, I'm gonna drink clean water. Someone get get my spring water in a plastic bottle.
Right.
80%.
Yeah. And then
80% of microplastic exposure is actually from drinking on plastic. And so if you'll spend, a couple $100, $300-400 a year on plastic water bottle. If you spend $1,000 and get the whole house system set up, that lasts for 10 years. And all of a sudden you actually save money over time. Yeah. It requires some planning, for food. I was a kid growing up. We didn't have a whole lot. The clothes I wore were all hand-me-downs or from the local thrift store. And we had a garden in the backyard. We have fruit. My dad was from West Virginia, and he kind of like brought his hillbilly from West Virginia with him when he came to Virginia. And we had a garden. We lived in Harrisonburg. We had a garden, and we had beans and all this kind of stuff. And I didn't realize that part of that was we couldn't afford to go to the grocery store more than every week. With 4 boys, you got to go like every day, right? And part of us making it work was like he'd hunt in the fall and process the deer. And we'd can the beets and can tomatoes, which I never liked those, and can the beans and stuff, and just made it figure out for the family. And so there's ways to do it. It just requires people being engaged and figuring out what works for them. And but people, it's work. You have to figure it out. It took me, as a triple board certified medical doctor, blah blah blah. It took me like 3 years to figure out how to source my food the right way and where to get it from and how to do it in a way that's feasible for our family. So it's not easy, but it's worth the work.
Yeah, we had someone on who's got a PPB sensitivity to corn. And it's taken her 15 years to figure out.
And then we're just listing everything like, weird stuff like condoms. Oh, there's cornstarch. It's like,
she had a great attitude about it. She's like, yeah, you know how I found out, huh? And I'm like, yeah, I can kind of guess. But like, she's saying the stuffing in her furniture is made from corn derivatives, right? And if she eats eggs,
that were the corn was the feed, she gets a reaction.
Poultry,
all of it.
Poultry, corn. You can have corn. Well, when mom's breastfeeding, the kids have rashes, and I'll tell the doctor tells the mom, don't eat this or that because your kids are having. It's literally going through mom's processing it, going to the milk, and the kid still has an allergy. Like this is the thing. But part of this is just if you eat real food, you try to clean the environment as much as possible. You can abate most of this stuff.
Right.
People just, it's when you've been eating processed food for 30, 40 years and you've been in moldy school and building for 30, 40 years. And then all of a sudden now you're in your 30s or 40s and you ache, you hurt, you have brain fog. Then it's like, okay, we need to get serious and do some really cool functional medicine things on top of everything else. But one of my passions is educating people, because if you start with your kids when you're young, then you can prevent a lot of the stuff with your kid and your grandkids. And you're impacting like generations of health just by you changing your life and giving them an example.
You've mentioned your daughter and she was on the website as well, but like what was her issues?
If you don't mind, give us the kind of...
was her issues food related?
We're supposed to be talking about my book. That's right. We didn't even get
there. we got time. We got 20 minutes.
We got time, man. I wouldn't let you off of here without talking about that, but
that's...
Most people come to us with like the wounded healer kind of archetype, right? Like something happened, they fixed the problem. Like, and I'm just curious what your story was, if you don't mind.
I mean, it started out, I was in the military. My wife, pediatric occupational therapist, worked with kids with special needs. And Anna was one of her patients and her foster home was closing down. And so she's like, hey, would you consider bringing this little girl into our home? And I'm sure, let's do this. Let's take her for a twirl, right? Let's see what happens. And, so trying to feed her, she was failure to thrive. And the GI doctor was like, look, she's small. You need to put a feeding tube into her. And we just knew that was the wrong thing to do. Her birth mother did crystal meth the entire pregnancy. She had a stroke before she was born. She was born functionally blind. Like the healthcare system said she'd never walk, talk, or crawl. And so, but my wife was like, no, it's going to be okay. And so we're not putting a feeding tube in this little girl that you've all given up on. And we got reported to Child Protective Services for medical neglect. Yeah, because we just wanted to feed her real food, which, and so that was the first inflection point where I realized the system doesn't like it when you say no. The second was the more impactful one 6 months later, when my wife found a growth chart for kids with Anna's diagnosis. The official diagnosis is cerebral palsy. And she was in the middle. She was 50th percentile. Okay. The expert had no idea that this growth chart existed and was getting ready to start a journey of one surgical procedure leads to another. The typical kid who's 20, who has her diagnosis, has had 13 surgeries. Okay.
Wow.
And so that doctor's not knowing this existed could have resulted in Anna going down that pathway. Oh, by the way, she's had 0 surgeries. And so all of a sudden I had to figure it out. The burden was on me as her dad and as a medical doctor to figure out what options I had for this little, 14, 16, 18-month-old girl, to have her heal as much as possible, to be the best version of her she could be, to be her normal, right? And that got me up at 4 o'clock in the morning, reading research about autism, about gene-based nutrition, about functional neurology. And over 10 years, it changed my entire practice of medicine. It's impacted thousands of patients. But part of the book, Incurable, is like, my daughter is going to be my first child leaving my home this April. And this is a kid who's supposed to be in a wheelchair the whole entire life, to be a vegetable, to never walk, talk, or crawl. And she's a joy to be around. She lights up the room. People love her personality. And it's like, that was, that's been 18 years of fighting. And her journey, her story has impacted literally thousands of people. And I just want people to know about those options. You can, just because the doctors say there's nothing we can do for you, it's all in your head. You can't be helped. There's nothing wrong with you. Doesn't mean that's actually the case. And I want people not to give up, to have hope, because, her life has been miraculous. And my other kids have similar stories. My wife has had her own health journey, and I've had, to get to this point, thousands of patients. We have patients coming from around the country to see us. I mean, her journey in changing my practice of medicine has literally changed thousands of people's lives.
That's incredible. And honestly, you're saying that I had kind of a visceral reaction. Like when a doctor had tells me like, oh, there's nothing, that's just the way it is. It's almost like there's a piece of me, there's like a petulant child inside of me that's like, oh, go fuck yourself. I'm going to die. I'm going to go do,
it might be a real Gen X thing. I think that's a Gen X kind of mindset. Yeah, whatever.
I'm just like, it's almost like a challenge. You're like, oh, okay, so you told me I can't do it.
I had this one young lady come to me. She went to Mayo, and they told her she had this diagnosis of autoimmune autonomic ganglionopathy, which is really rare. There's like 50 cases a year. She couldn't eat. She had a tube in, like basically a PICC line in to feed her. And come to find out, mold was a big part of her issue and tick-borne illnesses. And as we worked through that, she actually got to the point she was actually traveling around the country, sent me a postcard of her hiking out in the West. It was a really amazing story about how, like, what a place like Mayo had just basically, this is your stamp, you're out. Had other things going on. That happens all the time. I had a guy come to me. He went to UVA, University of Virginia, amazing place. Was diagnosed with multiple sclerosis. Well, how common is that in a 30-ish-year-old guy? Not very.
Not very.
I just, comes to me. He's got Lyme disease. No one treats the Lyme. You treat the Lyme, 80% of his symptoms go away. They're going to start him on a biologic for life.
Wow.
Or something that and then we got the other 90%, the other 20% better. He also had mold issues and a bunch of other things. And it's like, I kind of enjoy this. I kind of enjoy the people who can't get better, because it's like, oh yeah.
Yeah, wow. Exactly.
Let's rock and roll. Let's figure this out, and it's amazing how many times you find so many different things that have been overlooked. I see cancer patients who have post-cancer with neuropathy and nerve damage. And it's like, oh, sorry. It's like, no, we can actually revert, the earlier you get people, you can actually many times
and this is radiation chemotherapy damage, not the cancer itself.
Correct.
Right? Yeah.
It's typically the chemotherapy, which is toxic to nerves and vessels and stuff. And I've gotten pretty good at getting people. And the sooner you get people from that radiation standpoint, the better, better outcome. I've had patients come see me, 10 years after the point. We had significant responses to some of the nerve damage from that. So it's just not giving up on patients, not giving up on people. And just because I don't know the answer doesn't mean there's not an answer. It just means I don't know it. And that's the reality of, that's the reason I have all those letters behind my name, is because as I've learned, I've tried to learn in places that give me some letters behind my name as I learned. So
you're looking for answers, and that you need to go digging, and it's normally in those places. But go ahead.
No, is my reaction to this question because I have a show on health, or is it other? Because when I hear people not doing the things you're doing, like everything you just said about, like, oh, we check for mold, we check for this, we check, those seem so natural to me now that, like, this is obviously like, why aren't we, like, at least taking a look at it? Especially when you say the words autoimmune anything.
Yeah.
It's like, okay, let's find out, like, what's going on there. Like, why aren't doctors doing that? Like, is this just literally not known?
I mean, you're not taught in medical school. You don't learn about it in your residency. I mean, you learn about it after you finished your formal training. For me, I've spent probably about $200,000 to $300,000 of my own personal money getting this extra training. Flying around the country, going to clinics. I mean, we took my daughter up to Ontario to meet with a specialist up there to use a thing called PONS, which is an oral brain stimulation device for her brain injury stuff. And so it's a journey. And so when people finish their training and now you got a job and you're seeing patients every 10 minutes. Where's time for that? Where's space for that? What's your motivation? Because, what do you get paid? How much extra has my salary doubled or tripled since I do this kind of medicine? No, it's the same.
Yeah.
You don't make more money doing this kind of medicine. It's hard work, and it's a lot of extra time and training. So why would someone do this unless they have a personal reason, unless they have a personal drive to do it?
Right.
That's kind of why there's not a whole lot of people doing it. And then how do you practice as a business? Because insurance doesn't pay for it. So I go to my conferences, my last one in Vegas, there were 7,000 people there from around the world at the anti-aging regenerative medicine A4M conference in Las Vegas. They rented out this massive space in the Venetian. And you talk with people and they're not practicing it in the real world because, like, how do I do this? And they're struggling with how to figure out how to use the information they're learning.
Oh, that's interesting.
The business model. Yeah. And so it's so many roadblocks and barriers. And so I've just been fortunate to, when I was in the military, I learned a lot of administrative stuff. I joined a private practice. I developed a lot of online things for it. Became the president of that organization, learned how to figure out things and create a business model that allows me to practice the deep kind of medicine that I really want to practice.
Yeah. And that's awesome. But that's also a lot. I've never heard that. That is a little bit disturbing that there's all these people that have an interest enough to fly their ass to Vegas and learn about it. And yet they can't
You know, this
put the
is
wheels to the road.
Matt, I think this kind of, we've had MZ on and with his cancer story and what he's doing as a patient advocate. We've had Todd Otten on. We're going to be, hosting his movie on practitioner burnout. But I think this is just, another thing that, like, a lot of doctors know the system isn't working the way it's supposed to, right? It's not the doctors versus the patients. It's the system over all of that, because to Doc's point here, there's clearly an interest from the physicians. There's clearly an acknowledgement that there's a better way to do this, looking more at the root, but the system itself isn't so flexible or not accommodating enough for people to actually do it, especially when you're treating, Doc, you said like eight minutes a patient if you were in a big practice, right?
Yeah, I mean, well, the thing is also like, okay, so the reimbursement for seeing a person for a particular diagnosis was the same. Actually, the amount doesn't change as you get more expert, and actually goes down with time because insurances have paid less and less. The only way you can make more money as a physician as you become more expert is to see more patients.
Yeah.
So the system is rigged towards volume, quantity over quality. And you get to the point in your career when you learn stuff, you're like, you know what, I want to do quality work, not quantity work. How do I, and I mean, the system is great for what the system is great for. We're trying to make an old system work in a new paradigm and a new model. The basic way healthcare is given out these days, it's not that much different than what my grandfather did when he would, like, what he was experiencing in the 50s, 60s, and 70s, right? You go to the doctor, you got a problem, they make a diagnosis, here's your treatment. If you don't get better, come back, right? How is that different? And with all the new testing, all the new stuff, there needs to be a relationship. This kind of medicine deepens the doctor-patient relationship. But the system, is with all the quality metrics, and now the government's telling me, like, you're a good doctor because you didn't prescribe a brand name medication, you prescribed generics instead, and you're a good doctor because your patient
you saved money. Not lives.
Like when I used to I did hospital care for 15 years.
Yeah.
One of the metrics, you might remember this. Did you know we made pain of a vital sign? And JCO would grade hospitals on these scores. And one of the scores was, do you control patients' pain? Up, down. What's the best way to control people's pain? Give them some bucks.
Numb them up. Numb them up.
They got really happy. They had little happy faces, and you got good scores. And the system was driving physicians to prescribe pain medications to treat pain because it was considered a quality metric. Like,
but see, just that right there, like if the three of us were sitting down at a table, right, and we're in charge of like the metric system for a hospital, and somebody suggests, hey, let's make pain a thing, it would take three of us probably 10 minutes or less to go down that bouncing ball path and be like, yeah, this is going to get abused real fast. Like, and it wouldn't take that much.
Well, Matt, look, this can, like, I'm gonna it would just light my Luigi votive candle here, but it's this is I think the heart of it. It's like, it's easier for me to shut you up and drug you up and it's cheaper and we can bill more. I just it's a broken system.
But I'm a business owner, Doc, and as all three of us on this call are, right? Forget if I'm trained up in medicine and functional or food or whatever, right? Forget about all of that. There is a huge financial tsunami out there right now around functional medicine and everything. Those MD VIP docs that I was telling you about, there was two of them that I didn't get to see because they opened their practice on, like a Monday, and by Friday they were at capacity, right? Like, and it's like, And because Baltimore's got a lot of population, look, we've got two huge hospital systems here, Hopkins being, worldwide, and UMD isn't far behind.
Isn't far behind, yeah.
Right. And so you've got a ton of support practices in the Baltimore area of, podiatrists and neurologists and cardiologists and everything else, right? So maybe part of it's that, like, I'm not sure Topeka, Kansas might have the surge of, I'm not sure that that's the case, but literally even now the MDA VIPs in my area have quadrupled since I started doing this, and they're all filled. almost none of them have capacity because they cap those at like, I want to say 500 or might be 600.
500, yeah.
Yeah, but what I'm saying is like 500 people fill that vacuum nearly instantaneously. That is not because they're sick. It's because they fucking want it. Like that's a market demand reality in my mind.
It's, there are answers out there. I feel like if we, one of my philosophies is let your winners run. Let your racehorse, your best racehorse, just let them go. And if they can remove limitations, remove practice restrictions. Like if I want to say I wanted to see you, either one of you, I'd say I'm just going to charge you $100 to see me. I'll give you 30 extra minutes, whatever. Insurance says you can't do that. You're going to accept our amount of money, our $75. And if you spend a minute with them, you get $75. And if you spend an hour, you get $75.
Right.
I charge a little extra for my extra time, extra expertise. With Medicare, if I want to go outside the system, they say, okay, you can be, off par kind of thing. And you can't come back to us for 3 years. So all of a sudden it's like, whoa, do I have that kind of gumption to like go off the reservation? Right. And if I don't make it, I can't come back for several years. Remove the restrictions. Malpractice, this kind of medicine is risky. It's above the standard of care. It's not the standard, it's above. Well, there's a legal risk. Hormone replacement therapy just became okay in November of 2025. I've been doing it for over 10 years. But it's a medical legal risk because what if something happens because the government says hormone replacement therapy is bad for you? Actually, it's good and lowers your risk for heart disease.
We just had a huge HRT guy on.
Yeah. But how many doctors didn't do that simply because of that risk? And the answer is the vast majority.
Yeah, I was just going to say all of them. Anybody who didn't do it
had this legal document written up that said basically you can grow, horns out of your head, and I'm safe if I give this stuff to you. And it's just ridiculous the wording I had to use for people just to give people good care. And so if you remove the restrictions, make me not scared of you to sue me. Make it so that if I feel like I've got some more value, I can charge a little more. These aren't fancy things. Then all of a sudden now you can do more, you can see more, you can treat more, but there's so many restrictions. And then educating people is what I do. I've got my own podcast, I've got blogs, I've got YouTube and stuff, in my book. I feel like the more we educate people, the more they're going to demand this kind of care. And that's going to force, people vote with their dollars. And that's going to change what the system's giving to you. And there's already rumblings that some insurances may start reimbursing for functional medicine, which actually scares me because they probably won't pay enough for it, or they'll say,
careful what you ask for, right?
They'll destroy it from within.
Well, they'll be like, you can't do that functional medicine, but you can do this functional medicine. Like,
right. Then you start qualifying like what's woo-woo and what's not.
Have you tried telling them to eat spinach?
Yeah. Right. So actually, this is almost a perfect segue into the not just the commercial part of this, but
he said he's got a podcast. Well, he's feeling it.
What I really want to know from that is like from the time you started doing like the podcast and all these big like these sort of more acceptable sort of ways to disseminate messages, have you noticed like an uptick in people sort of subscribing or engaging with you in any way? I've got to imagine
like they get the message now.
Right.
I'm not a very good dancing monkey.
Okay.
So what does that mean? That means like my YouTube channel and my Instagram and Facebook are like each about 5,000 people. They're not that much. My podcast, which I've been doing for a year, I had like 85,000 downloads last month.
Wow, so that's great.
Pretty good. It's actually, that one's actually blown up. The way I've noticed it is we for every one person that gets into my practice, we have like 20 people apply. We have a pretty, like to your point, there's a big need. And so where I've seen it is just that people are like, I want to see this guy. I want to see his partners. I want to see the people in his office. I trust them. I want to see Veronica. I want to see Jody. I want to see Dr. Jensky. Like, and that's where it's like kind of, paid off, I guess, so to speak. But
right.
I'm a numbers guy. I'm also super competitive, and I'm always like, why can't I get my Instagram? Why is my YouTube not going up? Right. I'm kind of happy that the podcasting is being successful because that's the first like social thing I've done that has like done going pretty quick. But ultimately, it's a vanity metric because ultimately, do people want to come see me? Yes. Are people coming from around the country to see me? Yes. I mean, I've had people come from Peru to come see me, coming from California. I did a consult with someone in Denmark. So the practice has grown. We've actually always been trying to slow the growth down of the practice just because there's too much need. So it's one of those things where, to your point, some of the more like fancy things, I guess I haven't figured out how to do the right, picture on the little caption.
Yeah, but I also would say you probably, this is not a 30-second reel. The conversations that you're having in a long form podcast are probably the best medium because it's not a quick answer, right? It's an interesting answer. It requires some explanation, one to like how the body works and kind of, the options available. And that's not a snapshot. Right. Yeah. That's not a girl in a bikini.
Right. Yeah.
Telling you about a green smoothie she drank.
What is interesting about having done our show is when I talk to people off air, like, specifically friends of mine or people who know that I'm doing this, and they ask questions about their own thing. And I say, hey, listen, we did an episode with this person. Go check that out. As soon as they get to like the second one, some people are like, tell me all of them. And you're like, great, I'm going to lean into this. And other people are like, isn't there just like a shorter one? I'm like, you should never listen to any of our shows because like there's no,
you don't want the information.
Yeah. If you're just looking for a quick in and out, like this is not the topics we cover, right? Like it's not, I mean, just on this show alone, this episode alone, we've talked about, like, we didn't even get into the light bulbs that I put in the house after we had a guy talking about blue light spectrum, right? Like, so, but like each one of these rabbit holes is like days to weeks of my time looking it up, finding out what works for my budget, my time, my ability. Like it's
which is why you have so many letters after your name.
Right. Yeah.
Like that's it. It takes a long time to learn. It takes a long time to disseminate.
Yeah, what I tell people is I've heard I've done over 400 blogs for mold, Lyme, hormones, bionickel hormones, like on my website. And that, to be honest with you, that I've had for one point in time, my mold was like one of the top in the country as far as people coming to my articles on it. So that I feel like has been really successful because that's what brings people to my website, my Richmond Functional Medicine website, and that's ultimately education. If people can get educated, encouraged, and empowered to take charge of their health, I feel like that's the key. And so I'm really big in educating people, patients, so they can become empowered to actually change whatever they can change, move whatever they can move. And so that's like what I'm passionate about. And that's been, I think, really successful. I think what I consider success. This is my picture of success. So during the pandemic, I was interviewed on a bunch of TV shows and talked about low-dose naltrexone for use with long COVID. And a young lady in Arizona somehow came across it, went to her doctor in Arizona. They gave her naltrexone. Her symptoms of long COVID went away. And she sent me an email saying, and it was like just the coolest thing. Like, I don't know you. I'll never probably meet you ever. I don't know your doctor. You just watched some one-off and it literally changed your life. That is so freaking
That's amazing.
Cool.
Yeah,
that's what I love to hear. That was worth that for me. I was like, that was worth all the bazillions of interviews that did. And
100%.
You watch the metrics. No more people came on our website. Had no more likes, clicks, follows, subscribes. But someone's life was changed. That
one time has got to be worth it.
That was like when I heard that story. That kept me going for like the next 3 months. To be honest, of course, it was a grind. At that point in time, it was a grind.
How could it not?
Well, the other side of this too, we've had several episodes pulled off of YouTube because they call it medical misinformation. And like,
we did have one guy who voluntarily surrendered his license.
Yeah. Well, I mean, I'm not talking about those guys. Yeah.
Matt wanted a controversial episode and I'm like, I'm not fucking talking.
Yeah.
I can't even do it with this guy.
Listen, I'm not even talking about the guys that are on the fringe like that. But here's the thing.
I was like, I'm an acupuncturist, and this guy's too fucking weird for me.
Yeah.
Wow.
But here's the thing. Where I was going with that is YouTube is kind of bitchy about it, right? Like they just will arbitrarily, and their decision is binding and final. Like it's not.
The appeal is not an appeal. It's a no.
Yeah, right. And so like if you are trying to build something up and you say something like this naltrexone, right? Like, which I don't know what the general acceptability of this is, but if it's not universal and like there's any sort of controversy around it, YouTube could very easily just be like, nope, this entire line of questioning is
Yeah.
You know, worse for Doc here, because you end up in front of a board sometimes, right? You know, I mean, I have a friend who used to do ozone therapy here in Maryland.
Mm.
And, you know, like, look, in other countries, this is considered pretty benign. And he ended up in front of the board. No one got hurt. What are you doing? Just what are you doing could be scary enough.
Yeah.
You know? So anyway.
Yeah. So the book, talk to us about that.
Yes, let's get into the book.
I want to hear about this a little bit more.
That's the reason I'm here, right?
We're going to have you back, man, because we can dive down any rabbit hole with you.
Sounds good. Awesome. This has been a fun conversation, but I feel like I'm on like a radio TV kind of like, you know.
We're like somewhere in the middle, you know. Let's keep it light, but like, you know, give the people something.
Give the people what they give them cake. No.
Give them cake. Yes. Yeah.
We're at that point.
Yeah.
Give them cake and some ribs.
Well, sometimes I feel like we are like that show. Is it cake? We're like, all right, I don't know. Is this a real thing?
Is this a real thing? Sure. Like, we've had those episodes too.
Yeah. But Incurable, it's basically the story of Anna. The whole story I told you about the doctor, protective services, my journey. I talk about other patients who've had their crazy incurable journeys. And I try to walk people through you can, if this little girl who, you know, was never supposed to walk, talk, or crawl can do it, you can do it too. And give people little nuggets, little things. There's a ton of free resources in the book. For example, I take the Harvard School of Public Health. They have a healthy buildings guide. One of the top public health organization in the world has a healthy buildings guide. Go figure. And I walk through it, actually do some videos and do some bonus material. So there's a lot of this stuff like that's in there. I have a food sourcing guide that anywhere in the country you can actually use it to find, you know, where to get real milk, real beef, real cheese, real whatever. So there's a lot of free things in it to help people on their journey. But the main story is just sharing her story, my story, other patient's story, so people can believe like this is, if it's possible for them, maybe it's possible for me. Because people there's so much bad information out there. I mean, literally, you know, we talked about removing petroleum-based dyes from our food system. People went bonkers.
Which is such a dumb thing to get bonkers about, isn't it? You're like, really?
People, you know, in 1996, I was told by my pediatric resident that red dye will make ADHD kids bonkers, so don't give kids food dyes. And I'm like, so why is it now, you know, almost 20 years? Yeah, 20, actually, no, yeah, 26, almost 30. So it's like 30 years later, we're doing the math here. Wait, so it's not 26, it's 20, it's 30 years later, like that we're actually, the government's doing that. And so people need to educate. They need to, it's marketing, it's education, it's, you know, drink the Kool-Aid. And so it's part of my ecosystem trying to educate people so they realize this is legit, this is real, and I can do it. It's not possible. Just start with baby steps. And so that's the kind of the gist of the book. And ultimately, my heart's desire is that my daughter's struggle is worth it. And the way it can be worth it, if the more people that can be helped by her story, her struggle, then in my mind, it's worth everything we've done. It's worth the hours, the bazillions of dollars we've spent on her care and my practice model and what I do. It's worth all of it if it can help as many people as possible. So that's kind of the point of the book.
See, that's awesome, man. I love that. Yeah. And you know, my family makes fun of me constantly because in my real, like, realized life, like that is the life, right? Because I'm like, so much of what we do that's not good for us is just because it's either habit or this is how my grandparents told me to do it and I'm still doing it like this, like with no further introspection, you know, and like just dumb stuff, like just reading a label, read a fucking food label. You know what I mean? Like, I mean, my wife went to the grocery store to buy ketchup like a couple years ago, and she just looks at the thing and she just grabs the ketchup, puts it in the cart. And I looked at her and she's like, what? And I'm like, what? You just grabbed the first ketchup you saw? You didn't look at any of the labels? She goes, why the hell would I look at a label of ketchup? And I was like, so I looked at the one she got. Second ingredient, high fructose corn syrup. I was like, so like, why would you buy this one? She's like, I just grabbed fucking ketchup. I didn't buy one on purpose or accident. No. But here's the problem. I had to read like a dozen ketchups to find one without high fructose corn syrup in it, but I did. And now years later, we only use that one, right? Like, because my wife's like, God fucking forbid I ever buy this other ketchup. And I'm like, but it's a stupid thing that's so easy to change. Like, it tastes the same. There's no difference. It's
Well, part of that, the food sourcing guide thing is it took us almost 3 years to figure out where to ketchup, coffee, basic staples that, you'd think it'd be easy. Where do you get your salmon from? Did you know that the orange salmon you buy in the store, it's orange, it's a dye.
Oh my God. I did not know that.
You just broke Matt's heart.
Okay, so like, why is a pink flamingo pink?
It eats
minerals.
Well, you eat these little algae that have astaxanthin in them. It's a dye. It comes from the little critters.
Yeah,
and then they get the same thing for salmon. They actually eat krill. They eat they have these carotenoids, and it makes them orange. If it's a farm raised salmon, it actually looks like tilapia. It's not
interesting.
red. It's like that, right? And they dye it.
That's fucking
so all
crazy.
Of a sudden now it's like so go to Costco, which I love. Costco's in my food source, and I love Costco. You can go there and get Alaskan sockeye salmon. One of the cheapest. It's actually the cheapest place I've been able to find to get it. And you can get that. It is
weirdly comprehensive. Their meat and fish section is oddly
not perfect, but in season it's the cheapest place. I mean, in season you get these beautiful slabs of salmon.
Right.
But like, where do you get salmon? And did you know that the average Atlantic salmon, it's farmed and it's fed pelleted food, and the color is a dye. It's not actually an orange color. So all of a sudden, like, where do you buy the right stuff? I saved someone, who listens to this, I'll probably save them like an hour, 2-3 hours of research. I'll just go to Costco and get it from there. I'm done.
Right. Done. Yeah. Easy enough.
And honestly, how that is like the most easy thing, right? We're all going to go to a bulk box store anyway, and if that's a good source, that's amazing.
I mean, they're great for European cheeses that you can get raw cheese there. European cheeses. You want to buy organic frozen berries. I love that for smoothies. Big bags, relatively, cheapest place. Not perfect on everything, but things like that, like, could save people. That could help people with the bump. Like, I can't do this because it's so hard. Here you go. Here's the menu. Boom, done. And that will help people start this journey. So all those resources, many of those resources are for free in the book.
Awesome. That's great. I'm really psyched about that. I can't wait to put it up because we put everybody's books and everything on the show notes and everything. So I can't wait to put all that, because like I don't want to say it's rare. Everyone's got something that they kind of leave behind on the show, but like the practical stuff I feel like is definitely hard to get, because so much of what we talk about is very involved, and some of this feels less involved, right? Like, go to Costco, like step one.
Clean water, clean food, clean water, environment.
Yeah.
So how do you do that? Here you go. Bam, done. My book's got it all in there.
Awesome.
Well, Doc, let us know let us know here for the AIs, like where to find you, all that neat stuff. Yeah, let's get all that out.
The main hub is just AaronHartmanMD.com, and that's like the hub that like has my little pictures and branding stuff. But there you can go to Instagram, Facebook, YouTube, podcast.
Yeah, sure. And that's AaronHartman.com.
It's AaronHartmanMD.com.
Yeah. Got it. Yeah.
AaronHartmanMD.com.
Got it.
Okay. And then incurableBook.com is the one for the book website. That takes you to Amazon.
Perfect.
But the way we track numbers is if you go to that and go to Amazon, then I know someone actually.
Then yeah, absolutely. Yeah. Awesome. Well, Doc, listen, this has been super informative. Like Tom said, man, a lot of new stuff coming on my radar today. That was awesome. Cool. So I appreciate that.
Yeah, thank you.
Yeah, absolutely. All right. Well, listen, guys, see you next time and have a great weekend. Take care.
Take care.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.